This is Diet Talk with Dietitian Michelle, your food expert. It is a diet program where we talk about food and how food affects our health. I am Michelle Umeadi. You can also call me Dietitian Michelle. Don't mind my voice today. It's still your Dietitian Michelle. Don't worry, I am just a bit under the weather, but I'm fine. I am getting stronger. So the voice might be a little bit down, but I tell you, the content is loaded, very loaded. Just wait for it. And I want to use this opportunity to thank Professor Aboki and Mama here for the introduction. Every time before I start this program, it makes me energized. It gives me some kind of vibe to know that people are waiting for me and I must put in my best. I must share my best. Thank you very much. And thank you, my producer, Mr. Sam, and everybody around me, Cosmos, Bright, Kosi, and those that I don't even know. You guys are amazing. Dr. Fish Radio is one of the best. One of the best, and I'm having a nice time. Thank you very much. So today, I bring you something good. You've heard about garden eggs. I'm very sure about that. And you probably eat garden eggs. And you've even heard that these are vegetables and they are good for you. Dietitians recommend garden eggs. Health professionals recommend garden eggs. But the question I want to ask is, would you say that garden eggs are good for everybody? Do you think anyone can eat garden eggs? Do you think because they're vegetables and because it's recommended, it's good for everyone? Just stay, don't go anywhere. That is why I'm here today. I'm going to give you some information that you need to know about foods that we eat. Now, garden eggs are classified as vegetables by dietitians. Why? Because it has a low carbohydrate content. One fruit, for example, one serving of fruits like banana would give you about 15 grams of carbohydrates, whereas one serving of vegetable will give you just 5 grams of carbohydrates. So yes, indeed, vegetables falls under that category that we call vegetables that have low carbohydrate content and high fiber content plus low glycemic index. So everything that qualifies it for something good for people living with diabetes is checked for garden eggs. So yes, dietitians recommend it. We say people living with diabetes will benefit from garden eggs for all these reasons. So we tell them to eat it. But do you know what? Guess what? It's time for us to gist now. I have encountered a patient who ate these same garden eggs with all these good qualities, and his sugar level spikes whenever he eats garden eggs. Are you hearing me? Yes, the garden eggs that you know, the one that when you eat and you finish one bowl, you don't feel guilty because you have just eaten vegetables, you've eaten healthy food, you have taken fiber, and now you're hearing that Michelle say that a diabetic ate garden eggs and his sugar level went high. What went wrong? In Nigeria, that is what we call double wahala for dead body. Dietitians have said eat this food. Health professionals have said eat garden eggs. Now you have eaten garden eggs and your sugar level has gone up. What is the problem? I'm about to tell you now. All right? The issue is not with the garden eggs. Please don't get me wrong, because I know how we can misunderstand information. Hey, don't eat garden eggs. So Dietitian Michelle said it raises blood sugar. I didn't say that. Listen and listen carefully. This is a disclaimer. You can take this as a disclaimer so that you will not quote Dietitian Michelle tomorrow and say she said we should not eat garden eggs. So it raises sugar level. Garden eggs are not good. Dietitian Michelle said I did not say. Please listen and listen attentively to what I'm about to say now. We are all different, all right? We have different genes. So the way my body will respond to certain foods is different from how another person's body will respond to the same food. So that is just the issue here. It's not a matter of if garden eggs are vegetables or not. Yes, they are vegetables. But we all respond or react to foods differently. Have you not seen people who are sensitive to pineapple? Have you not seen diabetics who will take pineapples and their sugar levels will be high? Another person who is diabetic will take pineapple and nothing will happen. What is the difference? Gene. Is it the food? No, it's not the food. So when we generalize food, that is when we have a problem. Like in this client, I'll tell you more about him. I'll tell you more about this patient and how we discovered what the problem was. But first and foremost, let me tell you what this episode is for. I call this the case study episode. This Tuesday is a Tuesday dedicated to sharing case studies, practical case studies of people that we have worked with, patients that we have helped to achieve control in the management of diet-related diseases, just to convince you that dietitians are food experts, to convince you that there is a service we provide that is called medical nutrition therapy. Another name for this is diet therapy or just diet treatment. Do you understand? So this episode is dedicated to just this reason, to tell you that it is important for you to consult dietitians when you have a diet-related condition. Even if you have not been referred, as long as you have a case that is diet related, please insist on seeing dietitians. The service we provide is medical nutrition therapy, and it is not the same as diet guidelines. It's not the same as eat this, don't eat that. Let me explain medical nutrition therapy and what we do, just in case you're joining us for the first time now. We are dietitians, we are food experts. We went to school, we were taught about food, we were taught the nutrients in food, we were taught diseases, and we were taught the foods that are right for certain diseases. All right. So in providing medical nutrition therapy, there are basically 5 stages. First is our nutritional assessment. We have to know what the problem is. So we can't just walk on the streets and gallivant and say, oh, we are dietitians, you eat this, you eat that. No, we can't do that. We have to carry out what we call assessment. We need to know what the problem is. So when we say, Dietitian Michelle, am I fat? How will I know? Do I know your body mass index? Do you understand? So first thing first, in providing medical nutrition therapy, we carry out nutritional assessments. Then we make our own nutritional diagnosis. The doctors may have made theirs, but we also have ours. We have to narrow it down to what we want to handle. What is the problem as dietitians? So we have to make our own nutritional diagnosis, set goals for the person. What do you want to achieve? How long will it take for you to achieve that? Before we even get to the consultation, and then plan the diet. Do you understand? These are the stages. Then we now get to monitoring. Now listen, that monitoring is what a lot of people avoid or we take for granted. But that monitoring is what has helped me, Dietitian Michelle, in achieving a lot of success in my management, because it helps me see things. It helps me see what somebody is responding to. It helps me see what someone is reacting to. It helps me see what someone is sensitive to. And it helps me to make clearer decisions. There are times where we have to change diet plans over and again down. We may have planned the first one, then we monitor, we notice some trends, we change. That is management. That is medical nutrition therapy. And it doesn't even stop there. It's not just monitoring. We now have what we call feedback, a clear information, a clear detailed report that says, this is how you came. Then we did this and did that. We implemented this and implemented that, and this is the result we have received. This is what we call medical nutrition therapy, 5 stages. So now that you have heard me say this, I hope you're not going to be among those who will be saying things like, oh, Dietitian Michelle, tell me what to do so that my tummy will shrink. Haba. Is that what you think about us? Dietitian Michelle, please tell me, what should I eat to lose weight? Dietitian Michelle, oh, you are a dietitian. How your husband is going to enjoy you. You are going to be a very good cook. I hope you're not going to be one of them. So that when you see dietitians or when you hear that someone is a dietitian and you need help, you will say things like, oh, I'll consult you. I'll need medical nutrition therapy. Oh, I'll be coming to see you. I need to be sure about what I am eating and how much to eat. That will now sound like somebody who has been listening to Dietitian Michelle and who knows what is happening. Yes, we will now call you a correct person. And yes, I was invited for an interview yesterday, and the first question that came, oh, still tell us, what's the difference between a nutritionist and a dietitian? And I laughed because I get to hear that question a lot of times. Now, take it this way. Dietitians are nutritionists, but nutritionists are not dietitians. The clear difference is that nutritionists are equipped with the right information to help you prevent diseases. So a nutritionist will tell you, cut down on sugar or moderate your intake of carbohydrates or take fruits and vegetables, do this, do that. So they are able to guide you. They can provide you guidelines, nutritional guidelines, and give you reasons why you should follow those guidelines to prevent a disease. But when there is now diagnosis of a diet-related disease that would require diet treatment, that would require diet planning, that is when dietitians now come in. We come on board, because not only can we tell you what to eat and how to eat to prevent diseases. If it happens, we're not praying that it happens, but peradventure it happens, we are still there to help in the management. We'll be able to regulate some nutrients, able to regulate some foods, moderate some foods for you to get well. So that is a clear difference. We are now equipped with knowledge on how to calculate the foods, the nutrients, right? So we know the calories in the foods, we know the nutrients, we know the carbohydrates, we know the vitamins and the minerals in many foods. Not all foods, we are not magicians, but in most foods. So because we have this information and we are also trained on some of these diseases, mainly the ones that are diet related. They didn't teach us the one that does not concern us, but you see that one that is diet related, we were taught. And so we understand what happens in any diet-related condition, and we know the foods that would work with that diet-related condition, and we are able to co-manage with doctors and other health professionals. So I hope you are clear now, and you know the difference between nutritionists and dietitians. Now back to this, my client, okay, when he was hospitalized, and I happened to be part of the team managing this patient. And so because he was in the hospital, we were in full control of his food. The hospital was preparing the food and serving. So it's not a matter of people were bringing food from outside. So we have planned the right diet for him and placed him on the right diet. We shared it with the kitchen, and they were following the diet plan and serving him the food. Now, do you know what we discovered? When we go on rounds, we'll discover that when he follows this diet plan, on the days when he does not eat garden eggs as vegetables, we achieved good control. I mean, it looked like, oh, everything is fine, and this man is getting well, might be on his way to being discharged. Then on the days that he will eat foods that were planned, and there's garden eggs inside, his sugar level will go up. We kept screening, we kept monitoring from days to days, and we noticed that this man's body, somehow, for some reasons beyond our explanation, just didn't want garden eggs. That is a vegetable that dietitians recommend or prescribe. So can you see what helped us here? The monitoring, not just the consultation and not even the diets that we planned, but the fact that monitoring was part of the process. We were able to see that there is something in this diet plan that does not work for this client. And then we removed garden eggs. And guess what? He became better. And when we go forward rounds, we noticed that his system was responding better. So what the body was trying to say is, vegetables may be good, but it's not just good for this body. Do you understand? Vegetables are good, but it's just not good for this body. So we had to take this particular vegetable out of his diet for him to achieve control. Are you getting my point now? So please take this home, all right? What works for Mr. A may not work for Mr. B. Not because the food is bad, not because the food is not healthy, but possibly because we have different genetic makeovers. We are different inside of us. And until we listen to our genes, we might be making a mistake. You remember one time a caller called to say, why is it that I eat almost the same as my friend or a neighbor? I can't remember, but I am the fat one. And I said, yes, because your gene says you don't need that much. You eat for your gene, you don't eat what others are eating. So this is the message I want you to take home. In the management of diet-related diseases, there is no one-size-fits-all. You're going to be shooting yourself in the head. I'm telling you, you're going to be making a lot of mistakes if you're depending on eat this, don't eat that. If you're depending on, oh, tell me what to eat. If you're depending only on what should I eat, what should I not eat, you're going to be making a lot of mistakes. You need to know what works for you. What works for you. It's good to know what to eat, but how much you should eat and even when you should eat and the foods that works for you is important. We even have a client we are working with now. We had to use what we call a trial and error approach, diet approach, help her keep a food journal because her body is so sensitive that you would have to take out some foods that are ordinarily good, nutritious, but her body says it doesn't want it. Are you going to force the person and say, you must eat this food? No, we can't do that. So please, if you have a diet-related condition, just know that what will work for Mr. A may not work for you. And if you have not seen a dietitian, I encourage you, I advise you, please see a dietitian, consult us. We have different packages, different plans, and there are dietitians everywhere, not just at CNC, even in teaching hospitals. Find dietitians, narrow down your food, let it be planned, be clear. Oh, how much calorie are you placing me on? How much carbohydrates? How much protein? How much fat? These things are important for you to achieve control. It is called individualized approach, customized approach, and the name of the service is medical nutrition therapy. I hope you are clear on what dietitians provide, and you will not be among those who say things like, tell me what to eat to lose weight. I want to emphasize this again. Dietitian Michelle is not saying that garden eggs are bad or that garden eggs can raise sugar level. I'm simply saying that our bodies, our systems respond differently to different things. For you, it may not be garden eggs. It might even be pineapple. It might even be watermelon. It might be something else. But you need the help of dietitians, especially when we are working with you, providing medical nutrition therapy, to be able to tell what works for you and what doesn't work for you. We have to plan a proper diet for you, then you follow, then we start to monitor before we can tell what works and what doesn't work. If you have a diet-related condition, please don't depend on guidelines. I know you're going to be asking me questions and I'll be answering. Consider these guidelines and not diet therapy. Don't say I said you should eat, please. Don't say, I heard Dietitian Michelle say this and I applied. I know that the guidelines may help, especially those who don't have diet-related conditions. But if you do have, you are already diagnosed, or you know someone who has, don't depend on the information that I will be sharing here. Please, always consult, get a proper customized diet that can help you achieve your health goal. All right, so let me say again, we provide a service called medical nutrition therapy. Involves nutritional assessment, our own nutritional diagnosis, consultation, then diet plan, before monitoring, then feedback. You get that? That is what we provide, medical nutrition therapy, and not just guidelines or food counseling. Oh, we are just counseling people. No, we don't do that. So you are clear now, and you're not going to be part of those who say things like, tell me what to do to shrink my tummy. Dietitian Michelle, what will I eat so that my tummy will shrink? So we'll become tummy shrinkers. Is that not it? In fact, some people, immediately they are told they are diabetic, they just give up on life because they feel like there's nothing good that they will be allowed to eat. It's going to be only beans and acha and unripe plantain. But look, I'm standing here to tell you that it's now old school. All right, it's old school. People living with diabetes can eat and enjoy their foods. It's true that mangoes have sugar, pineapples have sugar, but even cucumber has sugar. Do you understand? Even garden egg has sugar. But see what I just explained now. A serving of pineapple or a serving of mangoes or bananas will give you 15 grams carbohydrates. Then a serving of vegetables will give you 5 grams of carbohydrate. Now, dietitians know how to plan this food. We know how to calculate it. We know how much of the mangoes we can put in your diet, even though we know it has 15 grams of carbohydrate. But you need vitamins, you need minerals. So we plan this food with the right amount of carbohydrates. Then we implement. You start to eat the food. Now, for somebody, you might take that food that we have planned. We have added pineapples and even mangoes to your diet plan as a diabetic. You eat it and there's no problem. Your sugar is well controlled. You're taking your medications, you're exercising, you're following the diet that has been calculated for you. You're not eating too much carbohydrates or too little carbohydrates. Your sugar will be all right. Then another person who cannot plan the diet for the same person will still add everything. We'll add the fruits, add the vegetables. And for some reason, we now notice that, oh, this person is reacting to this particular food in the menu, because you're going to be sending your reports. After taking this in the morning, this is my sugar level. After taking it, then we now go through the diet plan to see the particular foods you have eaten. Then tell you, remove this, add this, check again. At the end of the day, we are able to establish and say, oh, your body may not like these kinds of food. So you can see that there is no need to suffer. Now, going back to that story about this man's father-in-law, he said that the man was so frustrated that when he died, when they went to sweep his room, guess what they discovered? Under his bed were empty bottles of soft drinks, of chocolates, of sweets. Ashe, when they go and fling that food for him, and say, Papa, see your food here, the man will just be smiling, laughing at them. When they go, he sends small children to go and buy chocolate for him, to go and buy him biscuits, to go and buy him bread, to go and buy, do you understand? They buy him different things and he was eating. So that kind of person needs to be told that, look, we don't have to limit your food intake to just 3 meals. It shouldn't be just 3 things. You can eat virtually everything that every other person eats. All you have to do is to quantify it for you, to tell you how much you should eat. Do you understand? And when you should eat, and you would achieve control. So if you're diabetic and you are still part of those who eat just 1 or 2 foods or just 3 meals because you're diabetic, you are suffering for no reason, I tell you. You can eat most of the foods that we eat and still achieve control. This is still Diet Talk with Dietitian Michelle, your food expert. I just concluded this case study about a client who ate garden eggs, and surprisingly his sugar level went up. So we discovered, because of monitoring, that his body just does not want garden eggs. And I will say this again, like I have said over and over again, that garden eggs are vegetables, and we recommend garden eggs in the management of diabetes. But I like you to know that what works for Mr. A may not necessarily work for Mr. B. So if you have a health condition that is diet related, please don't depend on guidelines. Don't depend on what to eat and what not to eat. You need a proper medical nutrition therapy planned by a dietitian for you, so that you will know exactly what you should eat and how much you should eat, when to eat, to achieve control. I hope you're clear now, because it's not just about garden eggs, different foods. You heard someone say that when she eats beans, this is what happens to her and she's diabetic. Now, we are not going to enforce and say you must eat it because it's good. No, we don't do it that way. If it doesn't work for you, we take it out and plan the diet using other kinds of food. That is medical nutrition therapy. We want you to be in control. We want you to achieve good health. We want you to live happy. We want you to live free. You shouldn't be sad and depressed just because you're diagnosed with a diet-related condition. And health organizations say that these conditions are preventable, and that deaths from these conditions are also preventable, which means that people just don't necessarily have to die from these diet-related conditions. They don't even have to end up with complications. So you need to factor in diet. You need to see dietitians. Yes, you have seen the doctor, you're taking your medications, but what are you treating? What are you treating? It's food. Now, if you don't know how to handle that food, how do you want the medication to work? What if the drug you have been given, let's even say it's insulin, you have been given insulin, and the food you're taking is more than the insulin you're taking? How will it work? Or you're taking insulin injections and the food you're taking is not enough to match it. How will it work? Your sugar level will still be high and uncontrolled. So, in the management of any diet-related condition, nutrition is key. Diet is key. If not, I will tell you this, you can be taking that medication and still not be achieving control. It will just be like throwing stones in the air and you're not aiming at anything. What would now be happening would be a kind of titration, increase the dosage, reduce the dosage, but you have to face the main thing. You have to put diet into consideration. You have to plan the right diet. You have to remove nutrients that need to be removed. You have to add things that need to be added for that medication to give you the results that you want. So, if you're wondering, these are ways that we can help you at Standard Nutrition Consult, a team of dietitians, experienced, yes, and ways we can help you. You can schedule a consultation with a dietitian for yourself or for a loved one, or if you see somebody or you know someone who has a diet-related condition like diabetes, cancer, heart conditions, kidney problems, arthritis, the person is underweight or malnourished. These are all diet-related conditions, anemia, and so much more, and the person is suffering and it's not clear about what to eat and what not to eat. Yes, please see a dietitian. Consult us. Let's help you get your diet right. Now, if that is you, you can send consultation to this number 0708 987 3497. 0708 987 3497, or you can send to 0904 675 8079. 0904 675 8079. Just send consultation and we will reach out to you to tell you how we can help you. Then, for those who are too busy to come for physical consultation, we also have virtual consultations. And if you're listening to me outside of Jos, no problem, it works. most of my clients, I haven't met them. They don't know Dietitian Michelle. They've not seen Dietitian Michelle, and I have not seen them, and they still achieve results. So virtual consultation works very fine. We know you're busy and you can stay at home at your convenient time, and a dietitian will be available to consult you. You can just go to our website www.citadelnutritionconsult.com for virtual consultations, or you can still text consultation to these numbers 0708 987 3497 or 0904 675 8079. Plus, we have online courses. Well, you may not be diabetic, but you have a family history of diabetes. It's important for you to know the kinds of foods you should eat to prevent that from happening. Or you have a family history of heart conditions or family history of cancer, and you don't know the kinds of foods to stay away from or the foods to reduce the intake or limit. All these diet-related conditions, you will find the courses. We have online courses on these conditions on our website, www.dietitianmichelle.com. When you go there, you're going to see a lot of my courses, even on skin health, or even for pregnant women, what they should eat and how to eat. And even for those who have babies, children, overweight, obesity in children. These are courses you're going to find on the website www.dietitianmichelle.com. Subscribe, watch, listen, learn, and make guided information when it has to do with your diet. And we are also open for partnership. If you own a hospital or health insurance or a gym or a hotel and you would like us to provide nutritional services, don't just stop at giving diet plans to your clients. Yes, that might just be like first aid, but the proper thing is medical nutrition therapy. So if in your hospital what you give is just diet plan, you're not helping your clients to get well. So please partner with us. Let's provide medical nutrition therapy for your clients. You can just send partnership to the number 0904 675 8079. In Jos, Citadel Nutrition Consult is in partnership with some hospitals like Refit Medical, Zenith Life, and many other hospitals. If you go to our website, you're going to find that information so that when you're there, you can request to see dietitians. I encourage you, work with Dietitian Michelle and her team to get proper diet therapy in the management of diet-related conditions. You know what they are? Diabetes, obesity. Why do I keep forgetting that one? People who are underweight is still called a diet-related condition. Are you surprised? Yes, it is. It requires medical nutrition therapy. We have worked with people who are underweight and they are happy. In fact, they're doing so well. The transformation is wow. So it is a diet-related condition. Cancer, anemia, kidney conditions. These are all diet-related conditions that would benefit from a proper medical nutrition therapy. Don't wait until complications arise. It gets a lot more tougher. Yes, so it's better you see dietitians when there is a new diagnosis, or doctors should refer people when they are newly diagnosed, not just when there are complications. And I say, oh, go and see a dietitian. What happened? All this why? The person has been diabetic. Why has he not seen a dietitian? Okay, let me even tell you about this patient, a stroke client that I saw. He was already using walking sticks, and he saw me at Paragon Clinics in Port Harcourt when I was there. And during the conversation, and I was telling him about his diet and the road diet plays and what I'll plan in his diet, how I'll plan the diet. I mean, when we're having the conversation, do you know what he asked me? He said, "Now, Dietitian Michelle, I'm wondering, why did it take this long for me to get to see a dietitian?" Do you understand? Because everything you're saying sounds very new. I didn't know anything about that. I have just been busy taking my medications, and I'm wondering why I'm not making so much progress. Why am I just seeing a dietitian now? And I said, well, we are still creating awareness. Yes, and you can see why I come here every Tuesday, whether I am down or not, whether I'm up or down. I come here to talk, to create awareness about the role dietitians play in the management of diet-related conditions. So please, work with us. Let's help you get well. Let's help you get well. If you're not sure on what diet-related conditions are, you can even send a message. Oh, this is the condition I'm suffering from. Is it diet-related or not? I will respond. Yes, because I've heard people call me, Michelle, what food should I eat to cure malaria? And I say, please, malaria is not a diet-related condition. Eat adequate diet. Some will say, Michelle, what should I eat to shrink fibroid? And I say, it is not a diet. We don't call up the patients. We are not happy when people are sick. And then we don't just pretend pretend that we are experts of everything and we can cure everything. No, we don't do that. If it's not diet related, we'll tell you it is not diet related. Just eat adequate diet. If you don't know what adequate diet is, we give you a diet plan on adequate diet. Do you understand? But if it's diet related, we are happy to work with you to achieve control. So contact us today. Don't wait until problems arise. Now, I also invite you to be my friend on social media so that you can learn more. It's not just Diet Talk with Dietitian Michelle that I do here. I also have content, important, relevant content that can help you. Check Facebook, Dietitian Michelle, on Instagram, Dietitian Michelle, TikTok, Dietitian Michelle, Twitter, Dietitian Michi, then LinkedIn, Michelle Umadi, and then YouTube is the main place where you're going to find a lot of useful content on diet and nutrition, content that you may have been looking for. So go there and you're going to find a lot more. Join me again next week, same time, 5 o'clock on Dr. Fish Radio. I have an interesting topic coming. You know, next week is going to be Children's Day, and to celebrate them, I'm going to talk about one food that we are very fond of giving to children, Tom Brown. So call people, call mothers, call those that are around you who have babies, who have children, those who manufacture Tom Brown. Dietitian Michelle is about to shake table again. So next week we're going to talk about Tom Brown. Should we give babies Tom Brown? Should we give children Tom Brown, or adults should be the ones to eat Tom Brown? We're going to talk about that, and I bet you're going to learn one or two things. So stay with me next week, Tuesday, 5 o'clock, Dr. Fish Radio. Send links, talk to people, and for those who are not in JOS, don't worry, we'll upload the content on YouTube and you can always share the link with them to learn. Thank you very much for joining me today on Diet Talk with Dietitian Michelle. And until we meet again, I'd like you to make wise food choices. Bye-bye and God bless you.